Taiwan reported 1,209 local COVID infections on Friday, the highest daily tally since the start of the pandemic.
Despite the high number, so far this year, only 0.03% of COVID patients have developed moderate or severe symptoms, and about half of this group had not been fully vaccinated. The CECC says its current strategy is not to keep infection numbers low, but to prevent severe infections.
增长的比前2天都来得多，现在这个报告出来的是1209人。
The local daily COVID tally broke past 1,000 on Friday. Taiwan reported a total of 1,209 local infections, a new high since the start of the pandemic. New Taipei reported the highest number of cases at 328. It was followed by Taoyuan with 290, Hualien with 146, Taipei with 140, and Kaohsiung with 58. The CECC had previously identified Taipei, New Taipei, Keelung and Taoyuan as high-risk areas. Now, Hualien and Kaohsiung are on the list as well.
疫情以现在的发展的情况。
From the current developments, we're seeing a larger wave of infections. Some people say we'll have 1 million infections accumulated eventually. That's not entirely impossible, but we will try to keep it under control as much as possible. The most important thing now is not the case count. What's important now is keeping numbers of severe cases low.
Health Minister Chen Shizhong said the key to managing COVID now was preventing severe symptoms and not focusing so much on total case numbers. Taiwan added 10 patients with moderate COVID symptoms on Friday. They were patients aged between their 40s and 80s. Their symptoms included pneumonia and low oxygen levels in their blood. Most of the patients had previously diagnosed cardiovascular conditions, high blood pressure, or chronic hepatitis B. So far this year, Taiwan has seen 29 patients with moderate or severe symptoms and 2 deaths with COVID, meaning only 0.03% of patients developed severe symptoms. Among them, 48% were not fully vaccinated.
At
the start of this outbreak, we kept stressing that it's not about case numbers. It's about whether we can manage mild and severe cases separately, whether we have enough medication, and whether everyone is getting vaccinated or not. Those are the main things we are watching closely now.
Taiwan has more than 13,700 courses of oral COVID treatments in stock. So far, only 230 courses have been used up. In order to prevent hospitals from becoming overburdened, already New Taipei has launched a home isolation program for patients with mild or no symptoms. Kaohsiung has submitted an application to the central government to launch a similar program, and Hualien is preparing an application of its own.